I take you to Rwanda now. Julius Bizimungu is a business journalist with the New Times in Rwanda. Julius, thank you very much for joining us. In Rwanda, we know that you have not recorded any deaths. As far as we're told, your deaths are zero. 212 cases, 95 people have recovered. Give us a general overview of the sense of how COVID-19 is impacting your country.
Well, thank you. COVID-19 is impacting the country in very many ways. But when you look at some of the sectors that stand out in terms of the impact, the grave impact, these hospitality, tourism among the hardest hit sectors, because this is the country that relies heavily on tourism and hospitality. Hotels have closed, just like many other activities. Airlines have flying, and that is having a very very big impact on the entire economy. So just the other day, we were looking at the estimates that the country would be affected. We were at around 3.5. The economy would contract by 3.5%. From the previous projection of 8%. So that is a very, very big, impact. So, it's many sectors, services sectors are being hit. We're looking at the month of, I think, March and April. The government and the country lost around 30 billion. I missed out on 30 billion in the tourism, the hospitality sector, lost almost 30 billion revenues. So that's a very, very, very big impact. So it's generally many sectors that are being affected.
Certainly many sectors are being affected, but let's come back. Let me bring you back to the figures that we have. 212, I think, recorded. Nobody has died in China. One of the accusations against the country's authorities is that they did not really report accurate figures. To what extent do people in Rwanda, for example, believe in the figures being churned out, the official figures being churned out by government, such that there are no deaths, there are a lot of recoveries? To what extent do people believe in those figures?
I think, unlike other countries, really, Rwanda citizens really believe in the data that the government is giving them, because, first of all, Rwanda has a health system, public health system that is really strong. If you've been following for the last 20 years, Rwanda has been investing heavily in the health sector. So we haven't seen concerns of people really raising concerns about whether the data is wrong or not, because there's already that transparency and they believe that the government has really been investing in the system. And by the way, when this pandemic started, was announced, the government right away started taking the right measures. I think when you look at around January, when it was announced in China that there was a virus, the national airline the following day to fly to Guangzhou. So those measures, including the lockdown measures that the country took, were really, really helpful in helping the country really deal with the pandemic. And so there are a lot of centers that was built to deal with the pandemic in terms of testing, and the government got a lot of funds. Just today, beyond the IMF relief fund that the country received, we've been getting a lot of donations from countries like Germany. Today we got more than 15 tons of medical supplies from Qatar. And so there's a lot of efforts. The government has also invested a lot in making sure that there's testing is carried out, that tracking of the contacts of the victims is done. So I think there's a whole lot of metrics to justify that the government has really been able to deal with this. So
well, let me ask you this before I wrap up with you, that you talk about the lockdown measures and the immediate measures that government put in place when the COVID-19 started. I mean, some countries took their time to stop people from coming in, but Rwanda is one of the countries that quickly stopped that from happening. Give us an idea what these measures are and how they were done. I mean, how quickly, for example, did government put a ban on travels, for example? And as it stands now, what are the measures to prevent movement of people even within Rwanda?
Well, like I said, the government, first of all, stopped the airlines to come to Rwanda, and those going out of Rwanda, including the airline, the national air carrier Rwanda, immediately stopped all their schedules when the pandemic was announced in China. So that was one of the immediate moves. And now after that, a few days later, we saw the government implementing the lockdown, which included stopping all the public gatherings, including stopping all other activities. And basically, no one was allowed to go out except essential services. You're talking about food, you're talking about medical supplies, and you're talking about transport of things like cargo. And when you talk about other measures, for instance, that were very important, everyone arriving in the country was supposed to go under a 14-day quarantine, which was very, very, very important.
Right.
So the lockdown was extended in just like a few other countries, and I think today or the next day we are going to see whether it's going to be extended again. But the idea, I think, is to lift the lockdown, even if it were supposed to be lifted, to be in phases, because nobody knows exactly whether if we stopped allowed people to move right now to be the right move to go on. And I think putting in place, allowing companies to hand sanitizers, masks, and companies switching to production of things like mass product, all these protective equipment.
All right, it looks like I've lost Julius there. Julius Bizimungu there joined us from Rwanda with that picture of what's happening there. Julius, thank you very much for joining us all the way from Rwanda, and we wish you all the very best.